My name is Helen Harris, and I have been working with adults and children on the autism spectrum for about 20 years. This video has been made by the Windsor and Maidenhead Autism Partnership Board. It has been made in order to raise awareness amongst health professionals of the problems that people with Asperger's syndrome have when they visit their GP or other areas of the health profession and service. First of all, we will hear from Dr. Kathy Hutchins, a GP. Then we will hear from Dr. Trevor Powell, a clinical psychologist. People with Asperger's syndrome have communication difficulties and differences, and this video is about highlighting these difficulties and suggesting strategies to deal with them. We hope you find this useful.
My name is Dr. Kathy Hutchins, and I have been a GP for the last 26 years. I became interested in this project because my elder brother has Asperger's, and so I'm very aware of the miscommunication that can occur, particularly when trying to convey a medical problem. Communication difficulties often lead to misdiagnosis or late diagnosis, which can have very serious consequences. With adults who have higher functioning autism, there are many difficulties that GPs come across. Very often these adults live alone, so they do not come with an accompanying parent or carer, and so they're often very anxious when they arrive. The bright lights and noises in a busy surgery may add to their anxiety.
Hello, Doctor's Surgery. Can I help you?
David Harris to room 6, please.
They may be very worried about their problem, and this may also inhibit communication. They may get sidetracked or obsessed with one or two aspects of their illness, rather than focusing on the problem as a whole. So I think in general practice, we should try to think about the whole patient experience and try and improve that. Let's consider how we might improve communication before the patient gets to the doctor's surgery. The receptionist could be able to greet them and possibly offer a room that is quieter so that levels of anxiety are not going to rise in a very busy waiting room. The doctor also has a part to play in putting the patient at ease and to not come at them with a rushed approach. For example, they could just ask them how they're feeling or whether they had difficulties in getting to the surgery that day. I think when you're talking about symptoms, it's very important to have face-to-face contact and not to be looking at the computer at the same time. I think short, direct questions are helpful without using colourful or complicated language. Patients with Asperger's often have a very literal interpretation of words. Let me give you an example. When talking about pain, you can use a scale to describe how bad the pain is, and avoid colourful language such as stabbing pain, as they may think you're describing stabbing with a knife. Also, if they're feeling sad or depressed, don't use the word low, as they may literally think you're talking about being near the floor. Patients with Asperger's often have difficulties describing timescales. Can you tell me when these symptoms started? What happened or how long ago it was?
I really can't remember.
Were you doing anything specific when you first realised you felt so bad?
It was a while ago. I was watching my girlfriend swim because she's a swimmer, and sometimes it just felt like my mind was on other things. I mean, I was late going to see her afterwards. I just totally lost track of time. I mean, not that I've ever really had a good track of time. Mm-hmm. And I don't know how long a minute is or anything like that. No. So if I don't have my watch on me, which coincidentally she got me as a birthday present, and I have no idea how long I've been anywhere for any time.
Can you remember when this started, or is it difficult to?
I think it was 2 months ago. It might have been last month.
Okay. But of that order, so you've felt like this for a number of weeks.
Yeah. So, yeah.
And as bad every week, or does it come and go?
It comes and goes, especially when I'm with my partner. It gets better, but when she's not there, sometimes, especially if I'm alone, like if my parents are away and my girlfriend's away, it really hits.
Mm.
So I mean, it really, really hits.
Mm. Mm. Thank you. Okay. So you might assist by asking what they were doing when the symptoms started, and have a timescale or a calendar drawn out so they can show you how long ago it was on the calendar or timescale that the symptom developed. And you could add in their birthday and Christmas, for example, to give them, some markers. Let's consider whether sensory issues play a part when the patient visits the doctor's surgery. I do think because of their increased anxieties, patients can have great difficulties in this area, and surgeries would do well to consider this. It may be possible to have a quieter room where patients could sit away from the hubbub of the waiting room, or a screened off area with a fish tank, for example. It's also possible to suggest they wear headphones so that they can feel more relaxed and better able to present their symptoms when they come in to see the doctor. And if all else fails, they could possibly wait outside the surgery and then be called in when it is their turn. All of this, I feel, would help to break down anxieties and facilitate improved communication. One of the patients on the autism spectrum, one of the symptoms they experience quite frequently is depression. And it may be said that as many as 95 to 100% have some degree of anxiety depression. And this inhibits their ability to communicate and becomes a barrier between them and their doctor. I think patients on the autism spectrum have a great deal of difficulty in presenting their symptoms. They often present with a very flat affect if they're depressed, and may describe their symptoms in a very deadpan way, so the doctor doesn't necessarily feel the empathy towards the patient and pick up their degree of distress in the way they might in a neurotypical patient. It's extremely important to be aware of this, as missing a diagnosis of severe depression in a patient on the autism spectrum may have tragic consequences. In the busy world of general practice, we have to listen and formulate a diagnosis very quickly. We're often dealing with up to 5 problems per consultation in 10 minutes, and we need to rapidly associate a group of symptoms to recognise and reach our diagnosis. Over the years, this thinking has become almost automatic, and psychologists would call this method of thinking System 1. Let me give you an example. If a young man presents with a painless hardening of the testis, we would automatically think of testicular carcinoma. We would quickly reach a shared understanding with the patient and refer him on the 2-week wait pathway for cancer and follow him up and support him when the diagnosis was established. In a patient with Asperger's, he may not have the language to convey the symptoms. He may not describe the sensory symptoms in the way the GP is used to hearing them described. Instead, he may describe them in a much more literal sense. He may feel very anxious in the consultation and wish to leave as soon as possible. He may feel the doctor already knows what is going on in his body without him needing to describe the symptoms. He may have a degree of obsession with certain things and become focused on that and get sidetracked with the reason he came. All of this would hinder the communication with the consultation. The GP has to think much more laterally and carefully in order to assess the patient fully. The GP has to be aware of the other factors which are affecting the communication and adjust his or her style as necessary. We call this more complicated and time-consuming thinking System 2. The aim of this video is to improve the communication between the doctor and the patient with Asperger's, giving some strategies to help, and to raise awareness of the problems that are encountered. Problems which in this type of communication have occurred with some tragic consequences. I have outlined some practical solutions that could be used to improve the outcome of the consultation, and these could include, first of all, making the patient feel at ease when they come in. Just recognising the patient may be very stressed by the visit. Have the environment of the surgery more autism friendly if possible, so try and reduce lighting and noise, and try and avoid delayed appointment starting times, as this may cause distress. Use plain language and avoid using open questions, giving them a checklist, for example, and having a diagram of the body so they can relate the symptoms to that. And a written scale is also helpful. The doctor could use his hands to help indicate the nature of the problem. The doctor also needs to state clearly the patient needs to explain the symptoms to him, because otherwise he won't be in a position to help. At the end of the consultation, writing down the problem with instructions for the patients to take away is helpful, with also a follow-up time. And then after the consultation, consider adding a code to the patient's notes to include the whole practice, so including the receptionists, that the patient has Asperger's syndrome and therefore merits special consideration. It would be also important to try and ensure the same doctor sees the patient every visit, so a named GP would be really helpful. These strategies could be used for someone already having a diagnosis, which is recorded in the patient's notes. If a patient does not have a diagnosis formally, but you suspect the patient may have the autism spectrum condition, a number of tools are available to assist a GP to recognise this. For example, documents that can be found on the National Autistic Society website. And there's also a questionnaire drawn up by Professor Simon Baron-Cohen of Cambridge University, to which Trevor Powell will refer to in his presentation. As well as diagnosing the specific problem, which is the reason for the patient's visit, the GP can perform a broader and extremely valuable role in supporting the person with autism spectrum. They can signpost them to local community support services, of which they may be unaware, but can be a lifeline, as this group of people are often isolated, find it difficult to gain employment, and may find making relationships difficult. As a result, they tend to suffer more from depression and other mental health conditions. It is really important to think differently, to allow time for a patient to communicate their symptoms, and to try and approach it from their point of view, rather than trying to fit it into the normal neurotypical mould. Small changes make a lot of difference to help promote communication, and it is really important to appreciate the differences in sensory perceptions that patients have. Sometimes they can over-exaggerate their symptoms or else significantly minimalise them. And so always be aware of the patient and how they usually present is really important in this context.
My name's Trevor Powell, Dr. Trevor Powell. I'm a consultant clinical neuropsychologist, and I'm the lead for the Berkshire Adult Autism Asperger's Diagnostic and Support Service. I think it's important for people to understand a bit more about Asperger's or autism, because it is very much a hidden disability in adults. It's a communication disorder. So, for example, a few weeks ago I saw a man who was an IT specialist who had problems at work with his manager. And he came along here with his wife. He had a degree, he had a doctorate in IT. He worked for a software company. He was incredibly intelligent. But he was about to be suspended because of the communication problem between him and his manager. And his wife came into the clinic and she saw a sign on the reception desk saying, "Interpreters available." And the wife said to me, "That's what he needs. He needs an interpreter." In fact, this morning I saw a young lady who had Asperger's. She said she'd gone on the back of a motorbike with a boyfriend. And I said, "Oh, that must have been hairy." Immediately she looked at me completely blankly. But she didn't actually say anything at that point. And then later in the session, we talked about the fact that she got an autism alert card. And I said something like, "Yeah, that's useful to have that up your sleeve." And again, she didn't really understand it. And then we talked about the fact that she doesn't understand people speaking in these kind of metaphorical figures of speech. It's a real problem. It's like people speaking a foreign language. And it made me realise, and I've been doing this for 10 years, exactly what a problem it was for her. That someone on the autism spectrum might not understand, and they might not say it. This young lady this morning was saying, she'd often say, "Oh yes," and just go along with it, thinking, "I don't know what he's talking about, but I'm too embarrassed to say." So unravelling what had happened in our communication helped me to understand that actually she was really quite disabled by her inability to understand figures of speech and the kind of conversation that people have where they often take shortcuts. Communication and understanding of language is a big issue. Understanding of facial expression is another big issue. And a third big issue for people coming to see their GP is the fact that people on the autistic spectrum often have an array of sensory sensitivities, such as not liking bright lights, neon lights, particular noises, fire alarms going off, particular smells, crowds of people, being overloaded in a sensory capacity. And often hospitals, GP waiting rooms, somewhere where there might be a queue or there might be messages coming from different directions, is problematic for processing information. And again, it comes back to this notion that often people on the autistic spectrum have a kind of one channel of communication, and if there's lots of competing sensory inputs, it results in an overload. I suppose from my perspective, we get lots of referrals that come into a common point of entry. Some are very brief, some are more elaborate. It's always useful to get as much information as possible. So if the GP can write in the referral letter the reasons why the person wants the diagnostic assessment and what kind of difficulties or symptoms they've got, that would be very helpful. Once a person has got a diagnosis, as I said, often the reaction is one of relief, but that, for a lot of people, doesn't solve a lot of the issues. The ongoing issues for people, adults with autism, are numerous. Isolation perhaps being the biggest one. I think anxiety, there was a recent survey that indicated 98% of people on the autistic spectrum suffered clinical levels of anxiety. And certainly probably 50% of the people we see for a diagnostic assessment have some kind of formal clinical mental health problem, whether it be anxiety, OCD, depression. 20% of people who have an eating disorder are thought to be on the autistic spectrum. There are a number of screening tools that GPs can either download or have in their surgery. There's something called the AQ10, which is a 10-item questionnaire that's quite useful. There's a number of tools that can be downloaded from the Autism Research Centre site, which is the site run by Simon Baron-Cohen in Cambridgeshire. So the AQ10 is just 10 simple questions. First one is, I often notice small sounds that others do not notice. So often that sensitivity to noticing sounds is something that differentiates someone on the spectrum and somebody isn't. Second question, I usually concentrate more on the whole picture rather than the small details. Now that question's reversed. The opposite is true for people with autism. They focus on the details and are not very good at seeing the overall picture. Other questions, I won't go through them all. I know how to tell if somebody listening to me is getting bored. Now often people with autism might talk about one of their special interests with great enthusiasm but not actually pick up the fact that the other person opposite is not interested or getting bored. They won't be able to pick up the non-verbal cues. So it's a list of 10 questions that is a good screening tool for GPs or other health workers. And if they think that somebody's on the spectrum, they can refer them to our service and we'll do a more detailed assessment which involves an in-depth neurodevelopmental history, which means looking at the first few years of life, trying to get information from relatives, giving the people various tasks to do to measure social imagination. But most of the assessment is interview, observation of the person's presentation, and asking them questions. It's quite complex, and at the end of it, there is often, if the person gets a diagnosis, the emotional reaction of the person is often one of relief. That, you know, after all these years of struggling along and trying to find answers to different questions, why am I like I am? Why don't I fit in? You know, eventually someone comes along and says, the reason for why you've struggled all your life is because of this. And often it's quite an emotional experience that eventually someone has found an answer that they've been searching for so long.
And it helped me understand about who and what I was. It actually said, look, this is what you are, but these are the positives, and these are the fight. It just taught me so much. I actually learned about myself, and in a way that was a very liberating feeling.
So mental health issues are huge in this population, and to be quite honest, the medical profession, the health service, even the mental health service, don't fully understand autism and adults with Asperger's, because it is very much a hidden problem. So people get misdiagnosed as having a borderline personality disorder or having schizophrenia or a whole variety of things, where the real problem, the underneath problem, is that they're on the autistic spectrum, their brains are wired up in a particular way that makes life, living in a neurotypical world, very challenging. So people often wonder, well, what is the basis of autism or Asperger's? What's it all about? And I think over the last few decades, there's been a much greater understanding that what it's about is about the way your brain is wired up. So there's been a shift from it's all in the mind to it's all in the brain. People with autism have a different brain. That the social and emotional areas of the brain in people with autism are not particularly well wired up. Whereas the parts of the brain that deal with systematising, eye for detail, memory, rules, are incredibly well wired up. So you've got a brain that's slightly unbalanced. So someone might be very bright, very intelligent, have lots of information, but actually when it comes to the social and emotional world, be pretty inept. So that's the heart of autism. There's been lots of research looking at the brain of people with autism, there's some evidence that the corpus callosum, that's the bit in the middle of the brain that links the two hemispheres, is smaller. Other evidence that says that the cerebellum, that's the little bit at the back, is less well wired up. But there seems to be a general feeling that the brain of people with autism or Asperger's is over-connected in certain areas. For most people, there is a process where there is pruning of the synapses, synaptic pruning. That sounds very complicated, but all the myriads of different connections are relined up, and certain areas of the brain that don't require to be linked together, the connections are severed. But to people who are autistic, this doesn't seem to happen between those two, between the ages of 2 and 4. So you get areas of the brain that are over-connected. And that's why people sometimes have sensory issues where they will say, you know, coming into this room is like, you know, someone having 2 amplifiers on my ears. It's just, I'm just overwhelmed by the sound. So the brains of people with autism are different, just as the brains of people with dyslexia or dyspraxia or ADHD are different. And often people with autism do have those comorbidities. So they might be dyslexic, they might be dyspraxic, they might have ADHD, they might have Tourette's. There's a whole group of similar neurological conditions that are related to how the brain's organised.